Joining us now is Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases and a member of the White House Coronavirus Task Force and one of the busiest men alive. We so appreciate your time, Dr. Fauci. Thank you for being here.
Good to be with you.
Let's start with the antibody tests. I've heard you say that some have been developed and even validated. Are we really just days away from them being in use?
Yes, actually, at the last task force meeting, the individuals responsible for both developing, validating, and getting the test out are saying, and I'm certain that that's going to happen, that within a period of a week or so, we're going to have a rather large number of tests that are available. One of the things that you mentioned that's important, because other countries have gotten burned by this. These antibody tests are tests that we do on other diseases, but they need to be validated. You need to make sure that they're consistent and that they're accurate. And that's what we're doing now, both with the NIH and with the FDA, is validating them. As soon as they get validated, they'll be out there for people to use.
And so, Dr. Fauci, what does that mean for us? Does that mean that we are shifting away from an emphasis in testing for coronavirus to antibody testing to see who has had it and recovered?
No, not at all. I mean, those things are done in parallel. One does not essentially rule out the other. We still rely appropriately and heavily on the test to show that someone is in fact infected, whereas the antibody test says that you were infected, and if you're feeling well, you very likely recovered. When you're trying to find out whether a person is infected, that's the test we always talk about. But as we look forward, as we get to the point of at least considering opening up the country, as it were, it's very important to appreciate and to understand how much that virus has penetrated the society, because it's very likely that there are a large number of people out there that have been infected, have been asymptomatic, and did not know they were infected. If their antibody test is positive, one can formulate kind of strategies about whether or not they would be at risk or vulnerable to getting reinfected. This would be important for healthcare workers, for first-line fighters, those kinds of people.
Can you imagine a time where Americans carry certificates of immunity?
You know, that's possible. I mean, it's one of those things that we talk about when we want to make sure that we know who the vulnerable people are and not. This is something that's being discussed. I think it might actually have some merit under certain circumstances.
Okay. I want to talk about something else that we understand is being discussed among the task force and in the White House, and that is when to reopen the country. The president is eager to do so, as he has said. He's even eyeing the date of May 1st. Who is going to oversee that? Is there someone who is coordinating the plan for reopening the country?
Yes, that's a very good question. You know, it isn't a single person. As you know, the task force meets every single day, studies all the data that come in. There's also a group that's looking at what the best approach would be from the standpoint of the kinds of people that you'd want to get out there first, the people who are very necessary to the functioning of society. At the end of the day, we have FEMA involved. We have Dr. Debbie Birx, who is the coordinator within the task force, and we go over the data on a day-by-day basis, and we report it to the president and the vice president. That decision will be made at that level.
Are you comfortable with the date of May 1st?
Well, as I've said so many times, Alisyn, that the virus kind of decides whether or not it's going to be appropriate to open or not. What we're seeing right now are some favorable signs, as I've discussed with you a few times on this show. It's looking like that in many cases, particularly in New York, we're starting to see a flattening and a turning around. I would want to see a clear indication that you are very, very clearly and strongly going in the right direction. Because the one thing you don't want to do is you don't want to get out there prematurely and then wind up you're back in the same situation. So obviously we're looking for the kinds of things that would indicate that we can go forward in a gradual way to essentially reopen the country to a more normal way. But that would really depend upon a number of things that we really follow every day.
We are, of course, are on the cusp of a holiday weekend. Easter Sunday is when so many people get together and have big family dinners. What is your message to the country and for people who are feeling a little bit better and maybe more confident and might be tempted to do that?
Yeah. Yes, thank you for asking that question. I mean, as difficult as it is, we must continue to adhere to the mitigation strategies of physical separation that are in those guidelines that were first 15-day, now they're extended for the 30 days till the end of April. Appreciating, I know, particularly in a season like the Easter season and Passover, how difficult that is. But we really need to do it because it is working. The kinds of mitigations that we're doing now, the curves that we're seeing flattening and coming down, that's exactly and precisely because of what the American public is doing. So even though we're in a holiday season, now is no time to back off. As I say so often, now is the time to actually put your foot on the accelerator because we're going in the right direction. Let's keep in that direction.
Are the models that you're looking at still predicting Easter Sunday being the peak of this in terms of deaths in the country?
Well, as we said last weekend, as we're going into this weekend, that this is going to be a really bad week. And unfortunately, but predictably, it was a bad week with regard to deaths. But as I've said many times, deaths tend to lag behind what the driving elements of the outbreak are, namely the new cases that are coming into the system. So at the end of this week, we'll look back and say, that was really a bad week when it comes to deaths. But on the other side of that week, in the beginning, as we're seeing, particularly in New York is a really good example. At the time that day where their deaths peaked, they were seeing less hospitalizations, less admissions, less need for intubations. So it was really the way we predicted that the deaths would clearly lag behind the favorable parameters of what's going on.
Dr. Fauci, in our waning seconds with you, and on a much lighter note, Saturday Night Live is back this weekend. After a month of being off, what do you think the chances are that somebody will portray you?
I have no idea. I hope not.
Well, if they did, which actor would you want to play you? Here are some suggestions that I've heard. Ben Stiller, Brad Pitt. Which one?
Oh, Brad Pitt, of course.
It's fitting. Dr. Fauci, we really appreciate your time. We know how busy you are. Thank you very much for all of the information.
It's always good to be with you. Thank you.
You too.